Hello everybody, this is Zhou Zheng Beautiful Life, and today I'm lucky and honored to come to the church. It is a beautiful church, but I meet the wonderful man. He is Dr. Douglas Harrington. Hey,
How
Dr.
are you?
Harrington, how are you now? What is the setup here?
The setup is we've partnered with Coast Hills Community Church to provide antibody testing for COVID to the public in a very safe environment. So,
Okay, this is really because most of my interview always in the TV station, but the first time outside and in the church. I do a lot of the outside, but for this setup, like the medical something,
yeah,
could you a little bit introduce what's this for?
sure. So, what we do for the antibody test is we actually take your blood because we want to know what your immune system is doing if you've been exposed to the virus. In order to do that, we have various types of needles depending on you. This is a bigger needle, and if you have really tiny veins, we use something called a butterfly, and that blood goes into a special tube called a serum separator tube. You see this substance at the bottom will cause the blood to clot, and after about 30 minutes then we spin it down and that separates out the serum, and then we take that clear fluid at the top of this, and that's how we measure your antibodies.
Okay, Dr. Harrington, as a medical expert, could you tell me why densely populated countries such as Japan, Singapore, South Korea, China, they have been more successful controlling the viruses? Why?
Well, so that's a little bit controversial because it all depends on the accuracy of the information being reported and the amount of testing. So the US is currently testing more than anybody. And by the way, our death rate doesn't even make it into the top 20. We are not there. So while other countries might appear from a statistical perspective to be doing a better job, I think when we start looking at the death rates and the number of tests, that we're actually not doing very poorly at all. We're doing pretty well. And yeah, I think everybody had a shaky start. Nobody knew what was going to happen, and we've collected data, we've looked at the data, and I think it's one of those situations where we learn as we go along, and when we make a mistake, we admit it and we change course. And I think we're doing that. And I think the other good thing that's happening is countries are sharing information with each other. This worked here. This didn't work here. This happened in Italy. This didn't happen here. So as long as we do that, I think we're in pretty good shape.
Cool. From the standpoint of the public health, what do you think the United States and other countries like Europe could do better?
Well, I kind of use Singapore as a model. They were very quick to quarantine people that were at risk. They did contact tracing right away. And they also did longitudinal studies on patients to determine how long you were likely to be infective. And because there were a lot of reports that said, oh, the virus persists for 40 days and longer. And it turns out that the type of tests being used for those studies couldn't determine whether the virus was living or dead. And Singapore did a beautiful job of showing that 14 days after the onset of symptoms, almost nobody can transmit the infection. And that's been helpful to us because that gives us an idea of how long to quarantine somebody if they come up positive with a swab test. The other thing that they did really well, and I'm using Singapore because it's kind of an enclosed population. It's easier to manage that than it is a country like the United States or Indonesia, where you have 200 or 300 million people in multiple different states that you have to manage. But we learned from them. And because of that, I think we were able to take that information here. In the US, the one thing that's challenging is we have 50 states, and that means 50 different governments. It's like 50 different countries all in a republic. And the federal government can provide guidance, it has certain authority, but most of the authority lies with the local groups. So we need to make sure that we're sharing information among those. And I think in general there's been good collaboration between states and that sort of thing. So I think, I don't think there's one country that has done anything super better than anybody else, but we've all learned from each other.
And I heard of the even in California right now is 7 million people get test. Yeah.
Yeah, yeah,
Okay.
yeah.
I have another question. What challenges do you see ahead as we continue to face the global health crisis?
Yes. So this is a very important question, and it relates to the fact that we're finding out that this virus in a healthy person is not all that dangerous. But if you have diabetes, cardiovascular disease, cancer, chronic pulmonary disease, if you've had a transplant, if you're immune suppressed in any way, or if you're obese, you're extremely at risk of this. And what that says to me as a physician is we should really be focusing on prevention. Prevention of allowing people to get into these states where they're very susceptible to these sorts of things. And so going forward, I think we're going to have to make sure that we look more at a healthy living lifestyle as a way of preventing damage from this virus and future viruses, because it all comes back to that. If you have a healthy body, you can withstand these things.
As a physician, what relationship of the COVID-19 and heart disease?
So the virus is unique in that it likes a specific receptor in your body. It's called ACE2. And the reason that's important is because the virus, in order to reproduce, has to get inside your cells. To do that, it has to bind to this receptor. It turns out that the most dense population of those receptors are on the lining of your arteries, all of your arteries. By the way, that's called the endothelium, and it's the biggest organ in your body. It's about 7,000 meters squared. And because of that, the damage that it does to the endothelium predisposes you to blood clots and to heart attacks and strokes because of that. So we're seeing that in a younger age group if they're at risk, if they have a comorbidity like diabetes. So it's an inflammatory disease, and that means that the virus, just like flu virus, will increase the risk of having a heart attack and stroke, even after it's resolved.
Okay, Dr. Harrington, I heard about you already tested 1,000 people here outside of the church. And could you tell me what is the most importance of the antibody testing?
Yes, so the antibody test is not for people who have symptoms, okay? If you have symptoms, things like loss of taste or smell, fever, headache, chills, bone pain, diarrhea, you need the swab test. The swab test detects the genetic material in the virus, but if you're not symptomatic and you think you may have been exposed or have had it in the past, the antibody test is very important because it tells us whether you've had it in the past, whether your body successfully mounted an immune response to it. And it does one other thing, which is it allows our public health system to determine the actual prevalence of the disease in the community. And that's important because we're all working towards something we call herd immunity. And I don't know if you've seen the news today, but it looks like these increases in the cities are plateauing, which is a very good sign, very good sign. It means that we may have peaked and now we're going to plateau and things will start to go down as we achieve herd immunity. And that's prior to getting
congratulations. Yeah. What should people do right now? Pretty they're healthy. That's what I want to know.
Yeah. Well, you and I are appropriately socially distanced, and we've got our masks.
That's where top.
Yeah. We wouldn't take our masks off if we were closer than this. But masks have been absolutely demonstrated to help. They're not perfect. One of the things I tell people is that the average human touches their face 2,000 times a day. And so you can imagine if you get something on your hand and then you go psh, like this, you're transmitting it to yourself. So this helps that way. Also, if you sneeze, some of it will still go out the side, but it'll still protect people around you, But the most important thing is that you practice a number of things. Hand washing is critical. Hand washing, whether you use a hand sanitizer, spray alcohol, soap and water. Soap kills the virus. It ruins the envelope of it. The other thing that I'm cautioning people about You may have heard that we're using sewage to track the pandemic. The reason for that is the virus comes out in your stool and in your urine. And because of that, think about it, when you flush a toilet, the toilet can launch droplet particles up to 20 feet away.
Oh, wow.
So toilets you have to be very careful around, okay? So that's where you'd wear a mask and make sure you wash your hands carefully. If you have a family member and you're not able to separate them out and you have two bathrooms, they should confine themselves to one bathroom and you use the other bathroom. But it's just practicing good sanitation and protecting yourself and being very careful. It turns out that the virus is not as infective as, for instance, measles, but there are certain situations where it's more likely to cause an infection. If you're in a car with somebody who's infected, it's an enclosed space, you're there for a while. If you're in a train or a bus or an airplane, if you're in an office with the door closed and you're meeting with somebody, those are situations where transmission is more likely, okay?
Hello, everybody. This is Zhou Zheng Beautiful Life. Right now, I read it that I'm just interviewed Dr. Douglas Harrington, and right now, beautiful beach and a beautiful church. They're ready to test here the 1,000 people, the antibody test, and make me very feel confident. The COVID-19, the pandemic, we will find the solution. And everybody know if you want to have the beautiful life, you have to doctor. Before I only know if you infected or you got sick, you need a doctor. Right now, I think without the infection, before you get sick, you'd better find a doctor give you the good suggestion, advice, and instruction. So I will still like everybody. I want Dr. Harrington to tell us what is a beautiful life in his mind. Hey, Dr. Harrington, I want to know what is a beautiful concept in your mind.
My beautiful concept in my mind is that people would pay attention to their lifestyle, the things they do, the food they put in their mouth, the exercise that they do. Because it turns out that your immune system, 90% of heart disease, cancer is due to lifestyle, what you do to yourself. So if you think about that, I would like to see medicine move away from treating the disease after you develop it to preventing the disease from occurring in the first place. And that means you have control over your health. You can focus on your lifestyle. You can eat healthy whole foods. You can do the right kind of exercise, and you can try and avoid stress and sleep well, and it doesn't take much more than that. It's not all about drugs. It's about living your healthy life, because that makes you resistant to things like COVID-19. So
okay, like what the Dr. Harrington said, beautiful life is healthy, healthy, healthy. Like I always tell my audience, our life is have to follow life, healthy, and fitness. So, and before I cover that, I wanted our Dr. Harrington say your audience, you have to see, this is a Dr. Douglas Harrington. Thank you for watching Zhou Zheng Show.
thank you very much for having me, Joe.
You have to say your name.
Oh, my name is Douglas Harrington, and I focus on preventive cardiology and developing tests to find people who have disease at a very early stage.
Thank you.
Thank you.
We still shake hands. Thank you.
Okay.